Thank you, Madam Speaker. First of all, let me say this. I have the utmost respect for this chairman, and not only on this bill, but I've made comment in the past also. I think he's one of the leading talents in the chamber, and I think he will have a great career in this business in the future. And he did a marvelous presentation today. But I can't sit down and let this go without a comment on it. I'm really aghast. The hospitals are still complaining, and somebody said, well, they'll complain anyway. They're always going to complain. But they're making some good arguments if you stop and you listen. And they've wanted a couple of things changed. They feel they're being rushed into this. And they're talking about getting the financial house in order in 3 years, and they've been asking for 5 years. And I, for one, have no problem with the 5 years. But I'm not going to talk about the technical aspects of this. I'm just going to talk about this. We got this last night. And, gee, I don't have the supply of Visine that you do. But I was going to say that we got this last night. And I'm not going to embarrass anybody out there by saying, how many people read this? Let me tell you. Oh, no, I wasn't going to ask, but thank you anyway. But I was going to say one. But I'll say this again. This is a big, big step forward. I can remember they say if you don't learn by history, you're doomed to repeat it. I can remember a few years back, maybe 10 years ago, we were talking about HMOs and capitation. And everybody thought it was a wonderful idea. And I remember the chairman of healthcare at that time got up here and said, you know, just stick with it. This is going to work. And I can still remember the people standing out in that chamber, every senior citizen organization in the Commonwealth. I can remember the emails, and finally we retreated. We knew it wasn't working, and we took a big step backwards. I don't think this is going to happen here, and I hope it isn't. And as I said, this is probably one of the most important votes we'll take today. We've got a lot of votes today. In fact, I would say for me, it is one of the most important votes I have taken as a member of the legislature. It's that important. There are too many people who have the expertise, who have no axe to grind, who have faults with this bill. And they're not saying scrap it. They're saying give us more time. Let us put this thing together. You got a deadline. Today's the deadline. Why? It's really, think about it. It's an artificial deadline. Why not hold it and come back in the next session and finish it off, where everybody understands what's in this bill and some of the needs that are being talked about now are addressed. We're going to determine, and I don't care about what I heard earlier, we're going to determine which hospitals will succeed and which will fail. And I think the world of the chairman, but boy, that's quite an order when you say there'll be a hospital nearby for everyone in the Commonwealth of Massachusetts. We're always taking that step many times as far as legislation is concerned, and we do it in a half-hearted manner. By that I mean we really don't know the whole story. Because of what is in this bill, patients may not get the care they deserve. And I'll say it once more. One of the leading administrators in the Commonwealth is really afraid of what this bill could do as far as care is concerned. And I'm not trying to scare anyone. You know, you've heard the chairman. He made a great presentation. He's done all the things he said he did. He's been out. He's visited the hospitals. But he's got to be hearing some of the same things that I'm hearing. And it isn't that the hospitals are taking a very, very selfish position on this. We used to brag. In fact, we still do. We've got the best health care system in the world, or in the country anyway, in Massachusetts. People come from all over to take advantage of this health care system. One observer with a background, with all the credentials, says we're undermining our health care industry. And people know me in this chamber. I've never been somebody who gets up and just speaks against the bill for no reason at all. But I'm really worked up about this one. We've talked about savings, and I heard today it's $197 billion over the next 15 years. Yet the potential built-in costs in this bill are really dubious. And once again, there are folks who are saying, and one of the experts, and I'll name him, he's a fellow named Marshall from the Pioneer Institute, said we're probably never going to see that $200 billion savings. We're given this 342-page bill last night. We're supposed to digest it, cast an intelligent vote that will put it into effect. That's ridiculous. It really is. Think about it. 342 pages. That's what you've got. That's what you've got to look at, and you're supposed to really know what you're voting on when you're in here. I'll say it again. We should lay it aside, bring it back next year after we've had a chance to really understand it. After all, there really will be no turning back. Someone said earlier, well, you know, if there are problems, we can tweak it, adjust it, change it. You're going to have a bureaucracy, which includes an 11-member Health Policy Commission, Center for Health Information, and that's going to be governed by an executive director appointed by a majority vote of the governor, the attorney general, and the state auditor, and it's going to be up and running. And I'll say this again. What are you going to turn back? You're not going to turn back anything. Once you vote on this today, this is what you've got. And let me tell you, as I said earlier, those who don't learn from history are doomed to repeat it. It's an old saying. I'll still go back to HMOs and capitation. And let's talk about business. You know what I did for a living before I came here? I was a benefits specialist with my own insurance agency. So I've got the credentials, too, in that area. It's an important bill, which is still getting mixed reviews. And I'll say it again, we've got one of the best chairmen chairing this. He had an impossible task. He's done an outstanding job. Very rarely do you see a standing ovation for a presentation of a conference committee report. And I don't think I'll see another one in here for a long time. The hospitals in this district, in your own district, you should be listening to them. They're not saying scrap it. What they're saying is just give us more time. Give us more time to put our houses in order to accommodate what this bill is going to call for. So, once again, I'm just commenting on the bill. I'm going to vote against it. I am going to vote against it. Reluctantly. That's not my cup of tea. Reluctantly, but I really believe deep down we're going to live to regret what we do here today. Thank you. And you don't have to get up and applaud. My feelings won't be hurt.